In tonight's Woman's Doctor, a look at artificial disc replacement surgery. This is what an artificial disc looks like. It replaces a worn-out disc in the neck, which can cause terrible pain both in the neck and also the nerve pain going down the arm. Mercy Medical Center Dr. Charles Edwards II says people who have arm pain that is just not getting better with physical therapy and medication are good candidates for disc replacement.
In the past, a fusion surgery was used to treat people with disc problems in their neck. The fusion surgery works well, however, it takes away some of your natural flexibility. The advantage of the disc replacement is that it maintains your neck flexibility so that you can continue to enjoy a full range of motion.
Dr. Edwards says in the field of spine surgery, disc replacement represents the greatest advance they've had in the last 10 years.